So let's go.
All right. Well, we'll have a nice discussion today, and hopefully an interactive one, talking about potential uses for microscopy in telemedicine. And what I'll be talking about today are some initial steps we've been making to develop cell phone-based microscopes and present some of our current results and also current thinking about where this project can go. And please, at any time, feel free to interrupt and ask questions. So I want to start off right away with the other side of the coin. That is, this is the kind of microscope that most people who do biomedical imaging work with. These are fancy, fully functional microscopes that have the ability to look at samples with a range of different contrasts. And this is an example of one from Zeiss. It's very similar to one that we have in lab and use on a daily basis. And so I'm mostly used to talking about results from instruments like this, where the challenge is simply wrestling it into doing what you want it to do and focusing on the cells themselves. But today I want to switch gears a little bit and talk about the technology, talk about how the capabilities of an instrument like this can be very useful in the field, but how can we translate this capability into something that's movable into the field? And that's been the subject of this project, which we're calling Telemicroscopy or the CellScope project. So I'll give a quick overview of what the general concept is. And the general concept is that given the increased portability of electronics, given the decreased cost of cameras and of specialized optics, and given the ubiquitous spread of wireless capability, there presents an opportunity for using a combination of those things to transmit relevant information from remote locations to experts that are in some separate location and have that feedback. And so in this diagram, what we're trying to illustrate here is simply that one can use one of these portable electronic devices. Here I'm showing a camera with some fake blood cells pasted onto the screen. And that information can be transmitted to an expert, and then diagnosis or recommendations for next steps can be returned to that handset. And how this can work and how we can develop both the technology side and the support side for the clinical questions. That is, who's going to be doing the analysis? How is that going to be organized? How is information going to pass back? Those are really topics for discussion, and I hope to have some of that discussion here today. Let me begin also by crediting the people who've done the work here. This is very much at the beginning of this project. We're getting started. We're excited that we've got a proof of concept device working, and we're really getting started with implementing this. And this list of people have been instrumental in making that happen. Wendy and Neil were initially involved in developing the concepts in the class that I taught. And then that next group of people with David, Robbie, and a group of undergraduates from the class built the first initial system that convinced us it would work. And then a number of students from my lab have been very helpful in refining the technology so that we can actually take pictures with it and show pictures with it. And of course, Ravi Namana has been extremely helpful in opening our eyes to the range of applications that this technology may have. But I should point out that all of these people have been volunteers so far. That really only in the last few months have we been able to get some support listed on the right there for moving this project forward as a real project, as opposed to a part-time hobby for most of these individuals. So it's really been a group effort to get it this far, and we're excited about moving it forward. Okay, so today I'll go through a few different parts, and then would really like to have a discussion on some of the challenges that we face and some of the directions we'd like to go. Talk a little bit about microscopy for those who aren't as familiar with the background. I'll provide a brief overview of microscopy itself and how we can augment cell phones with microscopy capabilities. Then talk about some motivations. Why do we need a light microscope for healthcare? Then talk a little bit about the devices that we've put together. Our first proof of concept device, the portable devices we've been working on recently, and some initial evaluations of their performance. and then really end with more of a vision than results, a vision for how this might be integrated into healthcare delivery. So when you think about microscopes, this is one of the earliest microscopes that was developed. This is kind of the predecessor to that fancy microscope I showed initially. This is one made by Robert Hooke, and one of his drawings is shown on the upper left there, and it was apparently of organisms that were around him during the time he was doing these studies, and that looks to me like a flea. So anything that was around was the subject of microscopy evaluation back in the 1600s. And this was really a remarkable thing. It opened up a whole new world of small entities of unique features that you couldn't see to the naked eye. And it really helped in the development of understanding of healthcare as well. But it's worth noting that the best microscope in that day and age was actually not the compound microscope of Robert Hooke, but it was the microscope of Antony van Leeuwenhoek. And this individual was a fabric merchant, and he was able to develop extremely compact single lens microscopes that had the best resolution of the day, resolution on the order of 1 micron. And he did this by, I'll try and show you where on the slide, I guess I can't. There's a little dot in the middle of that plate, and that little dot was actually the small lens that was used in these handheld microscopes. So this is really a prototype for what we would like to have. We would like to have something that they already had in the 1600s. That is something that was easily portable, that could provide high resolution. But what they didn't have, of course, is the ability to transmit that any distance. So again, sketches were the way of the past, and now we have the ability to capture on CMOS or CCD sensors and then transmit those images over long distances. One of the resources on the Berkeley campus, a wonderful one for anybody interested in microscopy, is the Golub microscope collection, and this is housed in Valley Life Sciences building. And it's a wonderful display of the history of microscopy, how it's gone from these very simple handheld instruments to instruments that are more and more multifunctional. Some of these instruments have so many different knobs to turn that it's extremely easy to get things out of focus and very hard to get them back into focus. Most of the microscopes today have that resolved to a large extent, but the development you can see is increasing in complexity and in capability of these microscopes. So today we have this sort of system, and this sort of system allows you to do all sorts of use all sorts of contrast techniques, bright fields, fluorescence, various phase contrast techniques, and all of which are very helpful and relevant when you're trying to investigate a sample of that's somewhat unknown or study a particular process in a single cell. But for many applications, this enormous capability may not be absolutely necessary. So let me review, for those who aren't experts in microscopy, roughly what microscopes do, and then talk a little bit about what we've tried to make a cell phone camera do. Now, a simple thin lens like this will essentially transmit an object, some object in an object plane into an image plane. And depending on the position of the object relative to the lens, you get different amounts of magnification or minimification. So in this case, I'm showing an example of where there's no magnification at all. It's a magnification of 1. The image is exactly the same size as the object, and all that's happened is that this object has flipped. Now, if I were to slide that object a little bit closer to the focal length of this lens, I would end up with the image plane also moving further away from the lens, and the image getting larger than the object. And so we typically refer to the ratio of the image size to the object size as the transverse magnification of this lens system. Now, what Robert Hooke did was say, well, if one lens can get me a certain amount of magnification, then I bet 2 lenses can get me more. And that was exactly true. One can couple lenses together. This would be a 2-lens system. And I think in the image it's a little hard to see the lenses, but this is a system with 2 lenses, and the object is being expanded once, and then it's being expanded again. And it's the product of those 2 transverse magnifications which gives you the final magnification. The problem that Robert Hooke had with his initial compound microscope was that the aberrations in these two lenses were very large. And as a result of these aberrations, it wasn't possible to get very high quality images. And the trick that Van Leeuwenhoek used was to be able to aperture down the lens sufficiently to reduce the aberrations. And all of that is simply to say that the lens quality matters tremendously. And in this day and age, the ability to manufacture small lenses and to do so relatively cheaply has greatly improved our ability to make imaging systems compact, to have multiple lenses that correct for aberrations and provide very high quality images. So let's get to the question of motivation. Since light microscopes have been around for forever, or at least since the mid-1600s, what do we need light microscopes for now? Aren't there fancier techniques that are relevant to doing treatment? And so this is a diagram that Wilbur Lamb put together to try and explain where light microscopy is relevant in treatment these days. And so once you have an interaction with a clinician, and there's a decision to take a sample of some sort, light microscopy comes in a number of different places. There are the direct visualization applications where you have an endoscope, a bronchoscope, even an otoscope to look at your ear if you have an ear infection, where the clinician will directly use an imaging system to gather information about your health or lack thereof. But there are also a number of samples that can be taken from the patient and passed through some sort of imaging device. And those are tissue and fluid samples, such as blood and other fluids. So I'll focus a little bit on blood because, for one thing, Wilbur's a hematologist, and so he has provided a lot of guidance on what sort of blood imaging is relevant, but also because it provides a nice range of examples of where microscopy can be very helpful, either for diagnosis or for screening or for both. One example, and in fact all of the examples have to start with preparing that sample for microscopy. And the first step is making a blood smear. And so a blood smear starts with a drop of blood, and it can be a drop of blood from the finger. That's smeared onto a glass slide in an appropriate manner such that you get a single layer of cells that are dispersed enough for you to investigate their shape or their color or their morphology. And then combining that with stains that help to highlight particular features of those blood cells. And then you bring that to the standard microscope in the lab and you take a look at it. And again, here's another example of a typical microscope you would find in a histology lab, which has a number of different magnifications that are possible and a number of different treatments that are possible to do in order to characterize the sample. So once you have this blood smear, there are a couple things that can be done. One, you can look at this sample, or not me, of course, but a qualified professional can look at the sample and say, well, let's see, the distribution of white cells and red cells looks pretty normal. There are no malformed cells. This person we might consider to be normal, to be healthy. But there are other cases where simply looking at the blood smear is enough to give an indication of what might be wrong with an individual. And so here's a great example. This is a case of a patient with sickle cell, and you can clearly see that some of the red blood cells are severely elongated or sickled, as the disease name suggests, and that these malformed cells can contribute a great deal to problems with circulation, problems with blood flow, and in severe cases can lead to severe problems. So another example of how simply looking at a blood smear is going to provide useful clinical information. One that's particularly relevant to developing countries is detection of malaria, and this is perhaps one of the most relevant cases where optical microscopy is still the gold standard for evaluating if someone has malaria or not. There are a number of other technologies that are being developed, but they continue to be compared to microscopy in evaluating them. And the reason why microscopy is so useful is that with the appropriate staining, you can see the parasite that is responsible for malaria. So in these red blood cells, you can see these small blue colored structures, and those are the plasmodium that causes malaria. So again, imaging very relevant for diagnosis in this case. But of course, one of the challenges that's worth pointing out is that in order to find these few cells with malaria, one has to look at many, many fields of view, many, many different pictures like this, which may have no plasmodium, to find the ones that does. So it's actually a rather intensive microscopy process. One that's probably more widely investigated here in developed world as opposed to developing world is our leukemia. And the most striking thing from this image is simply the preponderance of white blood cells, which are stained blue, compared to red blood cells that are in red. And this is not like the normal cells the normal blood smear that I showed previously. So again, looking at the blood can reveal important things about health of the individual. One final example is one where there's been a deficiency. So something about nutrition not being properly provided. You can see in this case, again, not something that I would pick up initially, but a trained professional would be able to tell you that the shape of the red blood cells is not quite right. They're a little bit elongated. And that the white blood cell in the middle of the screen has multiple lobes of its nuclei. And that, again, is an indication of a deficiency, in this case, a B12 deficiency. So imaging is still very relevant for screening and, in some cases, diagnosis. But all of this is done in clinics where the kind of microscopes needed to take these images are readily available and are done where there are experts who can make this positive diagnosis. And so the challenge that we face in developing countries and even in rural parts of this country are how do we bring those two together? If we want to do this sort of diagnostic testing with light microscopy, must it always be done at a hospital? Must it always be done 20 feet from a clinician? Or can we try and separate those steps of data collection and data analysis? So to emphasize the challenge of bringing the tools together and the people who can use those tools together, this plot from the Millennium Project is instructive. This is a plot of where clinicians are in the world per 1,000 people. And so you can see in the U.S. and in Europe a large number of clinicians per individual, and that seems to correlate quite well with the status of our healthcare. That at least there is good healthcare out there, whether or not everyone can afford it. But in developing countries, predominantly in Central Africa and Southern Asia, you can see a significant lack of clinicians. And from the grayscale image, something under half a doctor per 1,000 people. And that's compounded by geographical problems, transportation problems. How I may be able to drive the 50 miles to the hospital with the specialty that I need, but in many parts of the world, that kind of transportation is not available or not possible. And so the distance is made even further by the lack of clinicians and the difficulty of getting to the clinician for help with diagnosis. You can also ask, where are the microscopes? Let's say we had access to the clinicians. In developing countries, there are resource problems with medical equipment. This is an example from Tanner, who has taken some images of what the clinic looked like in this particular town in Ecuador, a particularly small town. And this simple microscope is the tool that's, I guess you can't quite see that on your screen. Let's see, is there a way to advance the image? But the image is different from what's shown on the screen. So the one question is, where are the doctors, and the second question is, where are the equipment? And the microscopes, the microscope facilities are not necessarily as well developed as they are in our neighborhoods, and as a result, the kinds of contrast that are available to developing countries and clinicians in developing countries can be quite limiting. All right. We'll try and advance the slide one more time. Thank you. So we're back to the question of how do we link these two? How do we link the technology to take images relevant to healthcare and the experts who can guide diagnosis or treatment? And so moving to the next slide, the solution seems to be something that has nothing to do with us individually, but the growing movement towards greater communication availability across the globe. There are impressive statistics about how much of the population will have cell phones in the coming years, and there's a great deal of emphasis on using this sort of technology to aid not only in economic development but in provision of healthcare. And our hope is that by using this ability to transmit information over long distances through wireless networks, that we can add microscopy capabilities, link with clinicians, and then form a way of getting patient information and patient recommendations back to the consumer.
You say 90% of the population has cell phones, but 90% of the world population?
That's the estimate. 90% of the world population. That seems quite large.
It's like, I mean, the kids are more than 10% of the population. And is that the adult population?
Maybe it has access to cell phones, or?
I'm not sure. I don't remember exactly where that statistic came from. So,
my two kids are not going to get access to cell phones.
Right. This may be referring to the population that is above a certain age. I guess I should. Yeah.
I'm just wondering.
Yeah, but I think the overall trend that's clear is that access is expanding, wireless networks are expanding, and the possibility that we can use this in productive ways for healthcare is expanding as well. All right, so the way that we're trying to plug into this expanding network is simply by adding the capability to do magnification to existing cell phones. And the concept device is shown here. This is simply a drawing of the kind of device we'd like to have with the kind of magnification that we're aiming for, and coupling this with transmission or reflection illumination so that we can get different types of contrast within this single sample. So this is really our goal, and we'd like to make it into a device in which attaching simply a plug-in to a particular phone will enable this kind of microscopy. And so to a large extent, this is going to be phone-specific, since the cameras are different locations on different phones, but the concepts are quite similar, that we need to be able to magnify and transmit that image into the CCD of the camera. All right, so our first prototype looked like this. So nothing like what our concept device looks like, but it's a simple breadboard with lenses spread out. The image is transmitted from the sample through a series of lenses onto the CCD. So this is more of the kind of expanded layout of a traditional microscope. And that traditional microscope is quite large because there's really not a motivation to keep it too compact. And so we wanted to initially see, could we do this sort of imaging with a simple layout of lenses? And one of the tricks that I should point out is that with this sort of layout, what we really want is a bare CCD at the end of this optical train. We don't want another set of lenses there. So what we've done with this camera, this was my sister's old camera, we drilled out the lenses and exposed the bare CCD, and that allowed us to directly image onto the CCD to prove that there's nothing limiting about the kinds of CCDs that are in cameras today. So we needed to go from there to the second prototype, and that was rather than having a large piece of aluminum that must be carried around. That's clearly not a very portable system. We wanted to try and make that a bit more compact and image based on a series of lenses that were contained within a single unit. And so this unit is somewhat extended, but it has a combination of sample holder as well as illumination at the end, and this can be detached from the phone so that the phone can be used separate from this imaging system. So we've moved from there to our more current prototype, and this is the high magnification system. And this high magnification system is the one that we're designing for applications to blood cell imaging, and allows for, again, handheld microscopy. And in this case, we have not added an illumination system, but that is forthcoming. And it accepts a simple slide, much like the blood smear slide that would be prepared in many of these for many of these tests. And there's a simple focusing knob at the end of the optical train, right next to the sample holder. Now, the high magnification system is useful for some set of applications, but most microscopes have a series of different magnifications that are possible. And while each of these systems is designed for a single magnification, it was worth building a low magnification system as well, and it's pictured here, that allows us to look at, rather than single cell resolution, being able to look at larger relevant samples, such as wounds or infections or even a mole on your arm that you're worried might be growing. So low magnification as well as high magnification has the potential for applications in patient-driven healthcare. So here are some sample images. So these are just some samples some images that we've taken with our prototype devices, and some of these are from a set of slides that we happen to have around, and are not intended to indicate any particular maladies one will come upon. And several of these are for prepared tissue slices, so something that would be much more relevant for pathology type work as opposed to work in the field with blood samples. But just to show that there are a range of different types of images that can be taken. This next slide shows. Could you go back one? This next slide shows a blood smear. So I've showed a number of different blood smears at the beginning of this, and the standard microscope provides the ability to see morphology quite clearly. And with our CellScope image, while the resolution is not quite as good, the image and the ability to discern distinct morphology changes is quite good. We've made progress in trying to match the capabilities, at least on the blood cell shape evaluation, match the capabilities of standard microscopy. One of the applications that we'd like to focus on is the ability to count cells. And this is some work that has very recently been done by David Breslauer, who fabricated a simple set of chambers in which he could flow cells. And this is each of those small dots is a cell, and so this is a relatively low magnification system. And by counting these cells, one can gather information about different types of conditions. And what Wilbur has taught us is that in cases where you're being treated for some cancers, one wants to keep careful track of blood cell counts, red, whites, and platelet counts, and the ability to have a cell counting capability on a compact system like a cell phone would be quite useful. So these are some initial attempts to demonstrate that. And what David's done is evaluate what manual counting can achieve with a conventional microscope using a hemocytometer, and with this simple compact system using our compact microscope. And what he finds is that there's quite good agreement, both manual counting and with an automated counting regime. One of the challenges in the automated counting is that it's quite sensitive to contrast, and improving contrast is one of the challenges that we have for the system development. Okay, so I've talked about the upper left corner of this image. That is the particular technology, and the thing that we really haven't addressed to any extent at all is how do we get these images to the right people to evaluate them, and then how do we get some recommendation back to the patient or to the healthcare worker. And so that's the topic of our next set of work, and we need essentially two major components to that work. One is that we need to develop cell phone software. We need to develop software that allows for incorporation of some patient history, if this is being done by a healthcare worker, that allows annotation of images, if there are particular features that need to be highlighted, and that includes the ability to ask questions or make comments about the sample as it's taken. And then all of that information, that package of information, needs to be then transmitted to this expert. And that means that on the receiving side, we also need a set of software. And this could be clinical software that allows for expert opinions to be added, for queries to be returned back to the healthcare worker or back to the patient, and allows for eventually doctor recommendations to be made. That is some evaluation of this particular sample, some consensus idea of what to do next, and then that needs to be sent back to the worker in the field. And eventually, coupling this with an individual patient's electronic medical records would be quite useful. That is such that the kind of information that's being taken, if it's of clinical significance, if tethered to the electronic medical records of an individual, can provide a way of looking at, over time, how a particular condition has changed, how a person's counts, blood cell, white cell behavior is different under different treatments. Perhaps, say, someone is trying out different drug therapies, how that impacts their health. So all of these software systems that are going to couple the kind of information collected with a cell phone microscope to the experts that need to evaluate them are things that we're working on now. So what I'd love to get discussion on and input on are these topics. Specific ideas or questions or recommendations for high magnification applications, things on the scale of blood cells. Ideas for low magnification applications, what that doesn't require as severe or as significant a magnification but can still be relevant clinically. We're always looking for appropriate field test opportunities as we develop more and more robust prototypes. We hope to settle on one that we can then start to work with outside agencies on implementing, and then developing other applications for the device collaboratively. So I think I'll stop there, and would love to get comments, questions, or other discussion going.
In terms of number 3, what would be sort of the criteria or the limitations for field testing?
Let's see. I think we were looking for specific, rather specific evaluations where there's a way to compare to an existing technology. So if there's the case of malaria might be a good one where there is a standard optical test for malaria. We would want to see if we can replicate, achieve similar results to or better results than. So kind of do a side-by-side evaluation. I think that those are the kinds of opportunities that we're interested in.
You're not doing any of the software development in terms of
We're starting to do that. We're actually this summer have someone working on that. So we're definitely not software experts. So this is where, people who do know about software, it'd be great to get help. What were things to add about applications? Kind of low magnification or high magnification application?
Well, probably as you kind of alluded to, the best applications would be diseases in which microscopy is used, at least for screening, because we're still at the point where we need to really compare and really make sure this device is worthwhile. And also anything as we our team has kind of talked about in terms of staining for particular aspects of microorganisms or cells that have a particular optical signature. That if that's true for particular stains in which a certain color might be brighter, this device may actually supplant the current standard diagnostic devices if we're able to filter out colors and so forth. So I think that's always something we should be thinking about. But those are the main ones. And another thing also to keep in mind is this doesn't have to be for just blood. It could be for any tissue, especially for developing worlds. Other types of bodily fluids would be really useful to assess as well. Parasites that cause dysentery and tuberculosis in sputum samples and so forth. Very useful.
And any fluorescence-based samples too, since LED technology is coming out so cheap and with so many wavelengths that you can think of easily adding in filters.
Sure.
And do fluorescence-based microscopy as well.
Mm-hmm. So bringing some of the contrast techniques that we're used to on the big microscopes to something much more compact.
I think this user will be a doctor, medical doctor, or a nurses or technician.
We're hoping for relatively limited training would be required to use a system like this, so that in the case of doing blood smears, there's some skill that's required to do that properly. But we would hope that that it would be relatively little, and the point of this is to not require the well-trained clinician to be in the field at all times to contribute knowledge to that diagnosis or that analysis, but rather for someone who's minimally skilled to be able to operate this and have a communication with a centralized facility.
Today, we can buy very low-cost microscope. If you see only the blood cells, whatever, with 40x magnification.
Mm-hmm. Mm-hmm.
But I could see the cost of this one, of the optics, is not so low compared to the lowest microscope today. So I don't see the benefit at this moment
of
seeing this
adding optics to a cell phone.
So but I think the benefit is the cell phone's camera is very low chip, and which has communication skill also, and the memory.
Right.
That's it. I think we have to think about
the store and forward capability of scopes.
I think we can find a very good application.
So I think the point about the optics and the cost of the optics is a good one. That this day and age, the kind of optics that would be required to assemble the system at the end of a cell phone are it's not entirely clear to me what the cost is going to be. But I think it's always clear when devices find applications that the cost is going to be reduced as demand goes up. And so I would have not thought years ago that we would have cameras on cell phones at all. I would think that that's too expensive an item to put on where I just want to talk to someone. I don't necessarily need to take a photo. But now I think it's hard to get a cell phone without a camera, even if you don't want one. And so I think the question about what the cost of the optics will be is, I think it's hard to predict. What that's going to look like in a few years.
Also, a good application of retinal camera to see that.
Retinal camera, yeah. That's a
great.
That's a great idea. Good. All right.
All right. Well, we don't need remote participants, so I think that's
Thank you.